Ozempic, Wegovy, Manjaro, this really game-change weight loss medications, or there are more to the story?
Yes, definitely those are the game changers in obesity management and in weight loss. There are powerful tools to help patients to lose weight. But there's definitely more to the story, as they're not the only solution and need to be taken into consideration in more individualized approach.
There's a lot of hype. What's the biggest thing people don't realize before taking these medications?
Know that it's not a magic fix. Those medications are very powerful. They offer a lot of benefits. However, people need to know that they need to be ready to improve their lifestyle, to be guided by professional, and to actually get a success with use of those medications.
How do these medications actually work in the body to help with the weight loss?
GLP-1 is a naturally occurring peptide. It's a 30 amino acids chain peptide hormone that being produced in our gut. So all the GLP-1 agonists, they work on this peptide and on those receptors, and that improve glucose control and digestion, and thus addressing the weight loss. There are Ozempic or semaglutide is a single receptor medications. Tirzepatide works on glucagon inhibiting peptide, which is a double receptor agonist. Give you a little bit of background. GLP-1 receptor is represented in many parts of the body. They are present in human brain, they're present in heart, pancreas, gut. We actually producing GLP-1 in our gut, but as we get older, we produce it less, and that's why a lot of times our metabolic rate, our response to energy intake is different from energy outcome when we consume food, when we eat. So what it does, how it works, it addresses it. It's a GLP-1 receptor agonist, which is semaglutide. It works on those receptors. For the first one, the most important one, and that's how the medication was discovered originally, it works on the pancreas. Originally for diabetic, it stimulates the insulin secretion from the pancreas. It actually helps the pancreatic cells to be healthier, and that reduces the damage to the pancreas. So when someone has enough insulin to process the sugar intake that they take, obviously it's better for the metabolic rate. Second of all, the GLP-1 receptors present in the brain, in our satiety center, which is when the semaglutide is injected, it stimulates those receptors and reduces our hunger. And interestingly, it reduces our hunger not just overall, but specifically to foods that are high in calories, like fat, sweets, alcohol, because it's almost like foods that are addicting to your body. We all crave for comfort foods, what we call comfort foods. It actually helps to reduce those cravings for those comfort foods, so we can make smarter choices. Second, what it does, by being present in the stomach, it slows down the stomach empty, so food gets digested properly a little longer, so you stay fuller longer. That's one benefit of it. Second of it is it gets digested properly because it's not fast transition to the body. Third, it helps to make your gut healthier. Your gut healthier because it works in the GI receptors, so it reduces the inflammation in your gut, produces more mucus, and protects your stomach lining and GI tract linings, make it healthier, which again is very important for your normal microbacteria, normal gut flora, so it makes overall much healthier. Another action that's very important, it works in the liver. Our liver has numerous functions, but one of those, it produces sugar too. It's called gluconeogenesis. Mm-hmm. So we make sugar. So those medications will reduce that function in the body, will produce less sugar, but we're just going to metabolize everything we eat and make it into the energy as opposed to storage. So as you can see, those are a lot of benefits that to the medications by the way they work.
Some say you don't need to diet or exercise while taking them. Is that true?
Yes, unfortunately it is true because a patient will lose weight while using those medications without diet and exercise. But a huge caveat, what are they going to lose? Statistically, about two-thirds to half of the muscle mass will be lost if you do not exercise or eat properly. Protein intake is crucial for those patients who take GLP-1 receptor agonist medications to maintain their muscle weight and to maintain their healthy muscle weight, not just lose all the body weight, which is mostly muscle. That's very important metabolic organ in the body. I always tell my patients to not focus on a number because fat weighs less than muscle. So if they see the fast weight loss, they get excited. But actually, we have to be very careful and monitor their weight and see what actually they're losing.
How do Wegovy, Ozempic, and Mounjaro compare? Is there a best one?
So the difference is between different brand names, as I mentioned earlier. Ozempic is FDA cleared for diabetes, and Wegovy is FDA cleared for weight loss. It's the same generic medication, which is called semaglutide. Mounjaro or tirzepatide, what is the generic form, as well as Zepbound, it's all same tirzepatide medication, works on two receptors. It works on GLP-1 receptor as well as GIP, glucagon mimicking peptide. So it has a little bit broader spectrum, works on more functions and affects more function.
What are the most common side effects?
Most people who are taking GLP agonists will experience some kind of form of some degree of nausea, which usually body takes care with as the body gets adjusted to medications. Some may experience constipation, which is quite common, but can be easily addressed with proper intake of dietary fiber and hydration. People experience a little bit of fatigue and feeling sluggish. There's some notes that because it works on the brain, like dopaminergic receptors and hedonic centers, it may cause slight depression. Again, that's something that should be monitored closely. Hair loss, hair thinning, which is not direct effect of a drug, but more as nutritional deficiency. That's why, especially in the fast weight loss, so it's very important for patients who are on a weight loss program to maintain proper nutrients, essential amino acids intake to maintain their body functions. Some mood changes as well, and some people may experience inflammation of the pancreas, gassy or bloating. Those are the mild side effects. It is dose related, so I usually aim for patients to maintain the lowest effective dose to control appetite. And I think that really works on lowering those side effects.
Who should not take these medications?
Considering the serious side effects and more worrisome that would actually make me stop administering medications would be gallbladder disease, gallstone formation, and pancreatitis, severe vomiting, MSDs that could cause to severe dehydration and to the point of acute kidney failure. Thyroid cancer, it's really not proven in humans, but in the studies, in the rat studies, it shows some dysplasia in thyroid gland. So if somebody who has history of medullary carcinoma of the thyroid, MEN2 syndrome, those medications should not be taken. Another serious side effect, suicidal ideation, a very rare side effect.
If someone stops taking these medications, are they going to gain all the weight back?
Statistically, about 2/3 of the weight of people who used Ozempic, Wegovy back when person stops the medication. From tirzepatide, Zepbound, Mounjaro, about half of the weight comes back.
Wow.
That's statistically, but it doesn't mean that something should be a case. And I would like to go in a little bit more detail about it, because when a person loses weight and they're not guided by a healthcare professional, they're just taking medications, they're not exercising, they're losing weight on a scale. They step on a scale, the number goes down, they feel happy, but guess what? Along with the fat, they're losing the muscle. So consider our muscle is the biggest metabolic organ in the body. So even if you just lay down in your bed and look at the ceiling and do nothing, do not move your finger, your muscle consumes energy. It needs calories to survive. So if a person loses the muscle, guess what? They're metabolic, they have less muscle. So they need to have less calories to consume to maintain that muscle. So when somebody loses a lot of weight, and particularly that is a muscle weight, when they stop the medication, that basal metabolic rate will be lower. So they will have to eat even less than they were eating before to maintain that weight. In addition to that, if a person does not adjust their eating habits, does not start exercising, eating properly, eating healthier, eating enough, that's one of the also very important points to make. You have to be able to eat enough in order to maintain that muscle mass. They will have higher chances of regaining the weight back. Because the greatest benefit, I believe, of those medications, when someone is a little bit in their middle age, like 45 to 50, that's when most of the people experience the weight gain. Their body almost like gets adjusted to this basal weight. And people tell me, oh, I go on apple diet for a week and I don't lose a pound. Or I try all this exercise and I don't lose a pound. The body just sort of gets used to this basal weight for this person, individual. So after they use the medications and work, and the body gets adjusted and improved and optimized, they sort of reset that weight level, and it's easier to maintain that weight after that reset.
There is a concern about muscle loss. Are these drugs make you lose muscle or fat?
Going back to lifestyle modifications, the drug itself does not cause the muscle loss, but if someone that's on these medications and they definitely eat less, they has less nutrients, and if they don't exercise and maintain resistance training that trains the muscle to be where they are, they will lose not just fat, but they will lose muscle. That's why it's crucial to patients who are on these medications to have resistance training, high intensity resistance training, and as well as a proper high protein intake diet.
Patients can take these medications indefinitely?
Or should they?
Or should they?
It's a good question, because remember, we are addressing a very serious medical condition that is quite prevalent between us. It's with about 43% of people in the United States diagnosed with obesity. That's a quite large number. And worldwide, as of last year, I think more than 1 billion people are diagnosed with obesity, and many of them are children. So developing all those medications and using them will reduce significant risk factors for all the complications that arise from obesity, and I can go on for the whole day on that. So some people may have to stay on it simply because if they're prone to obesity and they have difficulties adjusting their lifestyle, they may go on what we call like a maintenance program, which is less aggressive, just sort of keep their body in check and continuously maintain the healthy weight. I don't usually promote that, although it is a possibility. For the most part, when it's a healthy person, they're just got off the track and they get a little older, their body is just not optimized, I do not recommend staying it for the rest of their life, and it's quite possible.
If the person like me comes into your office and saying Dr. Borisiak, I have this really important red carpet event. I need to fit in this dress. I would love if you can just prescribe me for a little bit, maybe 1 month, just a little bit of medications. Would you please do that for me? Would you?
That's a kind of tricky question. There is so many ways to help that person. If they come to my office, there's so many ways to help that person and get them to achieve their goals using other things, other supplements, and addressing their bodily functions in order to fit into that dress.
So basically the answer will be?
It's a possibility, but usually it's a no.
For someone considering these medications, what is the one thing they should know before getting started?
What are your goals? What are you trying to achieve? That's, I would say, probably one of the very most important questions to ask yourself. Are you feeling unhealthy? Are you feeling tired? Are you feeling fatigued? Are you not productive? Is your brain foggy? Do you want to feel better? Or you simply want to fit into a cute little dress? Second of all, I would advise patients stay off the internet. Do not buy medications on the internet. Look for assistance from licensed healthcare practitioner who can properly guide you, obtain medications from FDA cleared facility, and guide you through your process so you can have the most beneficial results for you, as well as to maintain those results.
Where do you see the future of the weight loss medicine? Are there better treatments on the horizon?
Yes, definitely. There is numerous studies are being done, and several drugs are being developed that are improved versions, modified versions. One of them is retatrutide. It's actually triple receptor agonist as opposed to semaglutide single. There's appetite double, and this one is triple receptor. So it works better, addresses more functions in the body, and more effective for the weight loss. And I think also another very important point, there are oral medications that are being developed right now, which are much easier for administrations and more accessible for people who are not comfortable with giving themselves injections, and they would be as effective. And I think that thirdly, very important to mention that it's not just obesity that's being addressed. Obesity can cause and is causing a lot of other chronic conditions. So by addressing obesity, by using the medications that are being developed right now, and studying the effect on the different body functions, we noted that it reduces inflammation, it reduces cardiovascular risk factors, it actually lowers the lipids, it reduces the inflammation of the arterial lining, and promotes more stabilization of plaque that develops in arteries. So lowers cardiovascular risk of stroke and heart attacks, as well as it treats non-fatty alcoholic liver disease, which is, I think it's a big one. So there is many other things that are being addressed along with obesity and weight loss in the non-surgical way. I think it's a future of medicine to study more, to improve, and to make overall nation healthier and the world healthier. In conclusion, I would love to say one more thing that I think it's very important, and especially for those who do not want to take any medications, right, but they still have a problem. I believe, and I think it's proven, that exercise is the best medicine of all. If you don't take a single pill, if you don't take a single shot, don't worry about a diet, but if you move, if you exercise, I would say you're probably about 75% of the game ahead of yourself. So before considering any medications, please get up and move.